the honor and privilege each and every day to lead an organization called Englewood Health. And our job is to help people. That's what we do for a living. And today we're here thanks to Congressman Josh Gottheimer on some bills he's introducing to the House of Representatives that are going to bring not just awareness, but hopefully funding to lung cancer. We do an incredible job in other cancers as far as diagnosis. You take breast cancer, for example. We diagnose stage 0 breast cancer at Englewood Hospital at a rate that's 50% higher than other states. What does that mean? Early detection means early intervention. It's better for the patients, it's less expensive, and you get people back to their loved ones sooner. We need to do the same thing in lung cancer. We need to take away the stigma. We need to create funds for screening, make sure everyone has the proper equipment, and get people to the clinical experts sooner. I also need to thank Congressman Gottheimer because as we stand here today, he helped us recently recoup all of our COVID money from FEMA. And if you think that's a little deal, it's not a little deal. So when you go to buy things like a low-dose CAT scanner for lung cancer screening, they're very expensive. And those are the funds that we're able to do it with. So thank you very much. It's incredibly meaningful to us. I now have the pleasure of introducing my friend, Senator Gordon Johnson, who's one of our biggest supporters, and he's going to lead us in the Pledge of Allegiance. Thank you, Senator.
Thank you. Good morning, everyone. Yes, it's an honor to be here and to lead this group in the Pledge of Allegiance. But before I do that, no, you can stand, you can stand. You can stand. It's a very short note. I heard a blurb this morning about nurses aren't professionals or some nonsense like that coming out of Washington. Nurses are professionals, period. All right, nurses are professional, front line, and a little bizarre policies coming out of DC every now and then, but that's the way it is. That's why we have Josh Gottheimer here to fight for us and represent us. And thank you, Josh, for what you do. Here we go. Okay, where's the flag? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you. I'm going to introduce our first speaker, Dr. Stavropoulos. Dr. Stavropoulos happens to be an expert in lung cancer and lung cancer surgery. He's our chief of thoracic surgery, and he's going to address you. Thank you, sir.
Thank you, Warren. And thank you, Congressman Gottheimer, for inviting me to be part of this important conversation. I've been treating lung cancer patients for many years, and I can tell you the difference between life and death is detecting it early versus late. At Englewood Health, our advanced diagnostic tools allow us to biopsy very small, hard-to-reach areas of the lungs, which can make the diagnosis sooner and with greater accuracy. When we catch it early, we can usually intervene more effectively and sometimes even cure it. When it's found late, our options are unfortunately more limited and the outcomes are worse. But today, there's hope in improving the outcomes even in patients with advanced disease. Biomarker testing is a critical part of this. It allows us to look inside the tumor and understand what's driving it, the mutations, the proteins, and the unique biology of that person's cancer. That information guides us to the most effective treatment for that individual patient. This kind of precision medicine has transformed how we treat lung cancer, but unfortunately, not everyone has access to it. These bills that Dr. Gottheimer is advocating for help close that gap They make sure that every patient, regardless of insurance or stage of disease, can benefit from the science and the tools that already exist. For our patients, that can mean more time, more options, and more hope. It is now my privilege to introduce Valerie Brown from Live Long Organization.
I loved it, by the way. My mother would be so proud. They called me Dr. Gottheimer. My mother would be so proud.
It's a pleasure to meet you.
How you doing? I figured I'd join us today.
Thank you. Thank you for inviting me to be here today. In 2012, after numerous doctor's appointments and tests, I was diagnosed with non-small cell lung cancer. Initially, a chest x-ray did not pick up the cancer, which in turn ended up I was being treated for a respiratory infection for months. A specialist sent me for a CAT scan, which did pick up the lung cancer. And at 49 years old, I was told, "You're too young to have lung cancer." And I thought, wow, I have 4 adult children and now 10 grandchildren, and I had my entire life ahead of me. And I thought, how could I have lung cancer? As a former nurse, I was struck by how little I knew about lung cancer. And over the last 13 years, I've had various treatments and tests. During my initial diagnosis, biomarker testing wasn't done, which led to my cancer metastasizing from my left lung to my right lung. For the past 6 years, I've been on targeted therapy, thankfully, due to biomarker testing being done in 2019. I've been on the targeted therapy consistently since 2019, which has significantly improved my lung cancer and disease. I continue to have CT scans and MRI every 3 months, which gives my team a really good look into my disease process. Lung Cancer Awareness Month serves as a reminder the urgency of the changes to the current legislation. Anyone with lungs can get lung cancer. And I'm here to support Congressman Gottheimer's legislation for the future of lung cancer patients so that they have access and care urgently needed. Together, we can change the narrative surrounding lung cancer. Thank you.
I believe Dr. Roy is next. Dr. Roy, thank you so much. Thanks. Thank you, doctor. Thank you so much.
Good morning, everyone. I am Dr. Rupal Basuroy, Executive Director of Research at Longevity Foundation, and we are a lung cancer patient advocacy group serving the lung cancer community since 2001. I want to thank Congressman Gottheimer for standing with the lung cancer community at a moment when we desperately need champions like him. The numbers tell a very sobering story. Lung cancer is the leading cause of cancer-related deaths in the United States. More than 120,000 lives will be lost in 2025. Of them, more than 2,600 right here in New Jersey. And that's much more than breast and prostate cancer deaths combined. Yet for decades, lung cancer research has been chronically underfunded. Our patients have been invisible in conversations that should have centered them. But today, that's changing. Congressman Gottheimer's legislation sends a very powerful message. Lung cancer patients deserve access to cutting-edge diagnostic tools that can save their lives. His bills requiring Medicare and Medicaid coverage of lung cancer biomarker testing will remove barriers for patients to access the best care possible. And for me, this isn't an abstract policy. This is very, very personal to me. When my aunt was diagnosed with lung cancer, she received biomarker testing, and that is what identified a specific type of mutation in her cancer called EGFR. And because of biomarker testing, she was able to take a once-a-day pill, and she was able to attend weddings and celebrate family events with all of us. And this, in my mind, is the promise of precision medicine. And this is about thousands of patients in our communities. Congressman Gottheimer also recognizes something, in my mind, very fundamental. We cannot fix what we don't measure. His lung cancer task force will push us to learn about the disparities, the funding gaps in research, and the gaps in lung cancer screening that have held our community back. What the task force will help us learn will become the foundation for real change. To the patients here, your voices matter, you matter. Congressman Gottheimer, on behalf of the lung cancer community, thank you for fighting for us and for believing that every patient deserves the best chance to live. Together, we will change the course of this disease. And now, it's my absolute pleasure to introduce Ms. Bene Taub.
Let me stay up here. Okay? Hey, guys. Thanks.
Good morning, and thank you for being here. I'm not used to speaking for 2 minutes, so this is going to be a special day for my family. My name is Bene Taub, and I'm going to be repeating much of what you've already heard this morning, so that should be a big indication for all of you that this is a common story, unfortunately. I'm standing here with Congressman Gottheimer in the fight against the deadliest cancer in America, lung cancer. I still cannot believe that I have lung cancer, let alone stage 4, incurable metastatic lung cancer. I live a healthy lifestyle. I do not smoke. I had no known risk factors other than one. It's already been said, I have lungs. And if you have lungs, you can get lung cancer. Lung cancer, I'm going to go over the facts again because it's really important for everyone to hear them more than once. Lung cancer kills more men and women than breast, colorectal, and prostate cancers combined. 1 in 16 Americans, look around the room, will be diagnosed with lung cancer. Every 2.2 minutes, someone in this country hears the words, "You have lung cancer." Every 4 minutes, someone dies from lung cancer. Increasingly, lung cancer is becoming a woman's disease. They don't know why. It's all over the news. The #1 cancer killer of women in America is lung cancer, taking more lives than breast, ovarian, and cervical cancers combined a year. Everyone gets mammograms. Everyone is running. It is killing more than those 3 cancers combined a year. The rise among younger adults, and these are women that are 20, 30, and 40, not only women, it's happening to men, but it's more often in women, young mothers, is staggering. Yet despite these facts, federal research funding still fails to meet the scale or urgency of this crisis. This year, Congress eliminated the lung cancer portion of the congressionally directed medical research programs, which is the only federal funding specifically designated for lung cancer research. That budget has now been reduced to $0. Zero. It is astounding and it's indefensible. That is why Congress Gottheimer's leadership matters so much right now. He is introducing 3 critical bills. You've heard about it. First, to create the task force within the HHS to address the lung cancer screenings and the severe disparities in research funding. Second, to amend Medicaid so biomarker testing for lung cancer is covered when medically necessary. And lastly, to amend Medicare so that biomarker testing is covered for all lung cancer patients, regardless of stage or prior testing. Biomarker testing can change a prognosis and the entire course of treatment. The targeted gene therapy that I'm on today exists only because of biomarker testing, and this medication didn't exist 10 years ago. That research allowed me to have surgery when I was told that I was inoperable, and that research is keeping me alive so that I can continue to make the memories with my 4 children, my husband, my family, and my friends, and all of you. These are life-changing tests and miraculous drugs, but they're not going to work for me forever. I don't know what my next option is if my current treatment stops working. Only research can answer that. So today, I am urging action. Get screened, talk about this disease, raise awareness, and help ensure these bills become law so that lung cancer research and treatment finally receive the support they urgently need. No funding means no research, and no research means no cure or progress for the #1 cancer killer in America. Anyone with lungs can get this disease, which means that every one of us has a stake in this fight. Thank you, and thank you very much.
You okay to stay? Yeah. Okay, thanks. Get in the way a little bit. Thank you so much. It's overwhelming when you think of your courage and how you've just kept fighting and keep fighting and standing here and going all over and speaking. I just want you to know how much we all appreciate it, and how much we look up to you and respect you. So thank you so much. And thanks to you and to Bob and to your dad for bringing these issues to my attention. Because I think like most Americans, and frankly like most members of Congress, until you actually get educated about this, you don't understand the depths of not just the crisis, the health crisis, but also the lack of funding. And I'll talk more about that in a minute, because it didn't make any sense to me, and I sort of didn't believe it when I first started working on this with you. But I want to thank Warren also for all you do here and for an incredible hospital that you run, and to all the physicians and to the nurses and to the techs who are here. Thank you so much for what you do every day to take care of the community. I hope you know how grateful we all are for you in this phenomenal hospital. So thank you so much. Senator, thanks for all you do in Washington for us, and Washington and Trenton for us. You want to come to Washington? It's great. I mean, I was on the... I figured that's what you would say.
Don't like Amtrak that
Christos, thank you so much. Doc, thank you so much for all you do here. To Dusty Donaldson, the founder of Lung Life. Valerie, thank you so much as well. Thank you for what you do. Sheila, thank you for what you do. Dr. Roy, thank you for your incredible leadership in the community. So grateful to all of you. There is a vicious killer, as you heard about, that is tearing families apart, and too many don't even know about. And because they don't, as you just said, they don't fit you don't fit the profile. You made this point, right? It's like, what, this doesn't make any sense. It didn't make any sense for you. Remember when we first sat down, it just doesn't make any sense. And there's not only a lack of resources, but there's a lack of awareness out there. Not just in the halls of Congress, but on the streets of our country. People just don't know, right? What's out there, the screening, what treatments there are. So with this month being Lung Cancer Awareness Month, I'm very proud to be here with so many dedicated advocates, including Benet and Valerie and so many others, to say that enough is enough. It's really time that we focus on this crisis. And the enduring strength and perseverance and work that you all do behind me and out there makes a huge difference, because it's actually starting to shine a light on an issue that you, again, can't believe exists. So I want you to know that what's getting out there, and we must get out there, is a key fact. Lung cancer is the deadliest cancer in America and across the globe. Right. It just is. You heard how many people, more than, I guess, 120,000 die, tens of thousands here. 1 in 5 cancer deaths are from lung cancer. 1 in 5 are from lung cancer. Every year, more people die of lung cancer, as you heard say, and I'll repeat it again. I apologize about repeating some of these statistics, but I think people who are watching need to hear this. Every year, more people die of lung cancer than of colon, breast, and prostate cancer combined. Again, more than colon, breast, and prostate cancer combined. You have the federal government, including NCI, NIH, and DOD, invest just a fraction into lung cancer research compared to breast, prostate, and colon cancer. Just a fraction. The private charity dollar investment, the differential is just as stark. For example, the Susan G. Komen Foundation, which does a phenomenal job and most of us have heard of, right, raises an average of more than $100 million in donations a year, where the Lung Cancer Research Foundation receives an average of just several million dollars a year in donations. Right. And it's mostly because of the stigma that exists around lung cancer, historically. We all know smoking increases your risk of lung cancer. But here's the thing that I believe impacts the research and charitable dollars. Even if you don't smoke, you're still majorly at risk of getting lung cancer. This is something that most people don't know. And so what if most people say, my mother of blessed memory died of a lung disease, not lung cancer, but a disease called sarcoidosis. And I remember when I said she has lung disease, and people would always say to me, oh, well, she's a smoker. So, like almost blaming her for her cancer, right? For her disease, which I knew they do the same thing for lung cancer. Nearly 1 in 5 of all lung cancer cases are diagnosed in someone who has never smoked. Right. I think we have to understand that. And we see these numbers increasing. Many families get routine checkups for mammograms and physicals as part of their preventive health care every year. Yet too many people don't know that they should also get regularly screened for lung cancer. Every 18 seconds, someone dies from lung cancer. That means that since I began speaking, roughly 6 people would have passed away. In fact, 1 in 16 people are diagnosed with lung cancer, which means nearly 227,000 will be diagnosed this year alone. It's not just debilitating for those who have it, it can be flat out deadly. If not properly treated, lung cancer can cause severe chest pains, a persistent cough, shortness of breath, and it can lead to recurring infections like bronchitis and pneumonia that go away for a short time just to rear their head again, further to punish the lungs already suffering. And unlike sarcoidosis, which we lost my mom to, if you detect it early, we can actually do something about it. If you detect it, we can treat it. Too many don't get diagnosed until the disease spreads, as you know and you heard, when treatments are less effective and the survival rate tends to be lower. Only 16% of lung cancers are found at an early stage. From 2018 to 2022, nearly half of all lung cancers were diagnosed after the cancer had spread to the lungs or from the lungs to other parts of the body. After having the disease for 5 years, the survival rate goes down significantly. We know that. But if you find it earlier, we know that the survival rate goes up significantly, more than 60% if you catch it in an early stage. That's a big deal, which stresses the importance of actually getting screened, of preventive care. This is not a partisan issue, right? This is not, oh, well, only party X or Y care about this. Everybody should care about this. It affects Democrats, it affects Republicans, families across our state and country. But there are some signs of hope. We know that here in Jersey, we're proud to be home to some of the best healthcare providers like this one in the country, the best. The best doctors and researchers working on this around the clock. Today, the survival rate of Jersey residents with lung cancer is higher than the national average. You heard Warren talk a little bit about that. And it's increased by nearly 20% over the last 5 years. That's a big deal. Think about that. That means we're making progress. We can't just take our foot off the gas, though, if we want to continue to make progress. Yet somehow, as you also heard Benet talk about, some extremists in Congress don't see it that way. Instead of ensuring our healthcare providers and families can get the help they need, last spring, the far right jammed through a reckless funding bill that slashed 57% of funding from congressionally directed medical research programs. This cut removed all funding for the only federal research program specifically dedicated to lung cancer research. So some people came along and said, oh, this is a great idea. What we should really do, even though we're making progress against this cancer, is why don't we just cut it? Cut the research dollars. The greatest country the world's ever known with the best researchers in the world and the best science only happens because we invest in it. That we continue to invest in the best people and in the best research. It's not just going to happen by accident. You actually have to invest in it. But so why would you gut the funding? It makes zero sense. But yet, that's what some people did because they decided somehow, I don't know, it was a waste. Cuts to NIH, DOD, and the research workforce, driven by HHS Secretary Kennedy and DOGE, interrupted key clinical trials and investments for finding treatments and cures. They paused biomarker research and canceled a study to improve access to cancer care for veterans. Insane. I don't get it. Why would you do that? Now, a bunch of my colleagues I've talked to, including I work with both sides of the aisle all the time, and they also said, well, the Republicans said, this makes no sense. Let's fix it. So we're going to talk a little bit about that in a second. But why would you turn your back and block investments with all this incredible progress with cell-based therapies and AI-driven cures and CAR-T therapies and gene therapies? It's incredible what's going on. It's plain heartless and stupid to cut funding for a critical issue that's ripping apart families. That's why today we're standing together and fighting to ensure everyone knows to get screened and to help ensure we support healthcare, research, and treatments to help families and to save lives. As a member of the House Cancer Caucus and the Congressional Lung Cancer Caucus, I'm announcing new bipartisan legislation and action in our fight against lung cancer. And I'm proud to say that all three pieces of new legislation that I'm announcing today are endorsed by the Lung Cancer Research Foundation, by Live Lung, GO2, LungCan, and Longevity. So everyone is getting behind this, and now we all have to work together to get them done. First, we need everyone to come together to tackle lung cancer head on. No more cutting funding and kicking the can down the road. The cure is in front of us, but only if we increase investment and keep focused and are smart about how we're investing. That's why I'm introducing the new piece of legislation called the Benet Taub Lung Cancer Research Act to create a specialized task force. That's my prize today. To create a specialized task force led by Health and Human Services and made up of members from the National Cancer Institute, the National Institute of Health, and CDC's National Comprehensive Cancer Control Program. This task force will look at exactly where the gaps are in access to lung cancer screenings and further ways to improve research funding. This will help tell us exactly what we need to do to finally help those who are suffering and help fund breakthrough technology to specifically combat lung cancer. And I'm proud to name this after Benet, who is such a strong champion for addressing these critical issues, for her courage, for her fight, for her friendship, and working with so many people in this room. and so many advocates to make sure that we continue to focus and that we don't take our foot off the gas in getting it done. So big responsibility. Now let's get it done, Vinay. After we get the results, not only will I lead the charge to implement these recommendations on screening and increased funding, but I'm also calling on House and Senate leadership to restore lung cancer research funding that was recently cut by this year's extremist funding bill. I will be writing to them this week. In the meantime, as we said, we know that lung cancer research is already being shortchanged, and it's always having to fight for its disproportionately small share of the total cancer research funding that's allocated. Right? There are specific dollars, basically, that are set aside for lung cancer. That's what was just zeroed out, that was cut completely. Then there's a bucket of just general cancer research, and that also not only is being threatened, but the amount of money that goes from that bucket to lung cancer, of the big bucket, is also way too small and not representative of the larger problem of how many people are affected by lung cancer. Right? That doesn't make any sense. That's why we're doing this bill, to understand the scope of this and how much should we actually be investing as a government and federally funded research into lung cancer, given the scope of the crisis. But in the meantime, while we're figuring that out, as we know it's the deadliest cancer, and that it gets far less than other cancers, while we're waiting for the final results of the study, I'm also putting in for an immediate increase of 20% for lung cancer research as a gap, as a stopgap, while we're figuring out the broader problem, which we know will be more than 20% needed, but this is a down payment on what is eventually needed. So I'll also be advocating for that immediately. Second, as talked about, we know that Medicaid provides life-saving care to those who rely on it. A study found that 16% of those with lung cancer relied on Medicaid for treatments. So I'm announcing bipartisan legislation with Congressman John Rutherford from Florida, Republican from Florida, to strengthen this critical program. The Improving Medicaid Precision and Cancer Testing Act, or IMPACT Act, will make Medicaid include biomarker testing for lung cancer, which is critical for getting the most effective, specialized care for patients with lung cancer. Since biomarker testing, as we just heard from others about, can tell patients and their doctors the best treatment to fight against lung cancer, this will be critical in our fight to more effectively combat this disease. Cutting red tape for Medicaid patients will literally help save lives and streamline the best treatments. Here in Jersey, we already have legislation on the books to support biomarker testing, but every state should be doing the same. It's common sense and it saves lives. We should be doing it. Third, I'm introducing the bipartisan Lung Cancer Medicare Access to Precise Testing Act, or the Lung Cancer MAP Act, with Congresswoman Jen Kiggins from Virginia, a Republican from Virginia. This will require Medicare to also include biomarker testing for patients with lung cancer, regardless of the stage of the disease, or if they receive prior testing. This will help stop bureaucracy from preventing families who rely on Medicare from receiving the proper treatments they need. Families should not have to jump through all these hoops. It's bad enough that they're dealing with this disease. To make them deal with the bureaucracy on top of that just makes no sense to me. We got to make it easier for people. Together, this will help save lives of those with lung cancer, to make sure they get the care and treatment and reassurances they need. Finally, I'm supporting two other key bipartisan bills that are key to investment in lung cancer research and screening. The bipartisan Women and Lung Cancer Research and Preventive Services Act will review current research on women and lung cancer, improve access to preventative services, and launch public awareness campaigns about the disease across the country. Also, the bipartisan Increasing Access to Lung Cancer Screening Act will help lower healthcare costs for families, expand access to life-saving cancer screenings, and reduce barriers to preventive care by removing prior authorizations for screenings. By removing those hurdles, this will ensure no cost annual screening under Medicaid and further help expand support and will further help support for those with the disease. With the health of our families on the line, we can't just go another day sitting on the sidelines here. We gotta fight. We have to. Because I know if we do, we can actually find a cure. I know if we do, we can actually help families across the country, including here in Jersey. This deadly and underfunded disease tears apart families. It's brutal. And it makes no sense that it's underfunded. No sense. It's long past time that we did something. Today is a call to action. The people behind me are incredible, all of them. This is not about me, and I appreciate everyone saying thanks to me. This is not about me. It's about them. It's about all these families. It's about, frankly, all the care providers in this room. You do the work every day. I have the easy part. You have the much harder part. So I want to thank everyone who made this happen, who's fighting so hard. I want to thank the Taub family, who are just incredible. I know a lot of them are here. They just do incredible work. They are just focused on getting stuff done. I mean, if we had 50 Bob Cooks, we could solve anything in this world, I think. And with Bené's courage and fight, it's a remarkable thing. And what you've done is just incredible. And your courage and your fight, right? I mean, and these doctors and these providers, it's just, we're lucky. We live in this great country. It's the greatest country in the world. I've been on the phone for the last month and all day this morning focused on the Affordable Care Act and fighting with some of my colleagues or negotiating. We're trying to get them to a good place. And listen, I'm working with Democrats and Republicans. I have a call with 30, a bipartisan group this afternoon, about getting a solution for the Affordable Care Act to help people, because these premiums are killing people, right? And people don't have, they literally are killing people. People can't afford health care, and then they don't get treatment, and then they get sick. Like, it makes no sense. Like, this is just basic stuff we got to get done. So I keep working with anyone, Democrats, Republicans, anybody who'll talk to me, to just get this stuff done, because we live in the greatest country in the world. If we work together, I know our best days will be ahead of us. It just makes sense. But we got to not do stupid things when we have smart things in front of us. And I know today, if we work together, we can get this done. Thanks so much. God bless.